All right, well, welcome everyone. As you can tell, I am not Terrence Roberts, but I am Dean Hebel, Executive Director of TATT, in case there's anyone I don't know. But I am glad to have you again with us for our TATT chat today. As you know, we've been doing these every other Thursday, or actually we started with every Thursday and then went to every other Thursday last summer, now for a year. So it is amazing. The first one we did in early April of 2020, and now it's April of 2021. But we are pleased that we're able to do these, and I know many of you have been on a lot of them, so we appreciate that. We said at the beginning of the year we were going to make sure that the topics were topical, and we had folks on who were focused on things that are part of what's impacting our community in many different ways. And obviously the fact that all of this started with a health emergency illustrates that is and remains a critical element of everything that we're dealing with. And so we wanted to invite Dr. Saccocio from Prisma Health to be with us. We are very fortunate. We have a number of great partners in the health industry. If you'll remember our last session, we had Dr. Hedgecock from ANMed who spoke about mental health. Our updates after the main presentation today will be from ANMed and from Spartanburg Regional, both of which are great partners of ours as well. Bon Secours, also a partner, and others. So we're very appreciative of all of them, and they have all done amazing work over the last year. And Prisma, as the largest health system in the region, and with hospitals in a number of our communities here in the Upstate, has a very unique perspective. And so Dr. Saccocio, we are very appreciative of you being with us today to give an update on what Prisma is doing, and then also kind of holistically. Now we're I guess we had someone from DHEC with us in early mid-January, right when the vaccines were starting to come out. So now it's a couple of months. We were just talking, several of us who either have or are about to get the vaccine. So it's interesting to hear your perspective on how that is impacting kind of what's going on from a health standpoint. So with that, I will turn it over to you. And again, thank you for being with us.
Excellent. Thank you so much, Dean. It is my pleasure to be with you today. Now, what I'll share with you is certainly some Prisma Health specific information, but I really would like to start off with the overall picture of what's happening with COVID today. And I hope that we have some time for questions to answer any follow-up that you have. And in fact, after this presentation and after your meeting, if you find you have follow-up questions you thought about afterwards or had with your colleagues, please feel free to email them to me. Of course, the team at 10 at the Top has access to my email and my phone number, and I would certainly be willing to share that with you. As we recognize, this is an ongoing pandemic, and our hope is that we see light at the end of the tunnel, but however, we still need to remain cautious while we bring our optimism to the forefront with the vaccination that's now available. So, and I'm thrilled to hear that many of you have received the vaccine. And for those of you who have your appointments scheduled or will be doing soon, again, congratulations, excitement all around, because this is the opportunity to put all of this behind us. Though we recognize it won't be completely over, this will just become our next respiratory season. And to me, that is a sign of achievement and success that we have come together as not only a country, but across the globe to fight this pandemic in a way that we have been so collaborative at the international level, the national level, and certainly by regions, and particularly here at 10 at the Top. So without further ado, I will be bringing up my screen. And if someone can confirm that you can see the slide deck I'm about to show you.
Yes, we can see it.
Excellent. Wonderful. All right. So we will just jump right in. I would like to share a little bit with you about Prisma Health. Many of you are likely familiar with our organization. However, we have had some changes recently, and we do still have our hospitals in place. There are 18 of them, and almost 30,000 team members with our system, and nearly 300 practice sites. So we are the largest health employer in the state of South Carolina. And we are focused on serving the entire community. Our purpose is to inspire health, to serve with compassion, and to be the difference. And I am proud to say that throughout this past year, and in response to COVID-19, we, along with many other healthcare organizations, have partnered together in a very collaborative way to do just that. And we will all continue to serve with compassion and to serve the needs of our South Carolinians in every way we know how, and continue to learn from one another. Now let's take a quick view of what's happening across the country with COVID. So for me, when I see these large numbers, such as 30 million, it's really hard to get a grasp on how many people that really is. It's just so huge. And we've all had experiences, either personally or knowing individuals who have been diagnosed with COVID, perhaps, bless you, asymptomatically or symptomatically. And tragically for some, we've seen over 500,000 deaths. In fact, it's 550,500 deaths across the US. And this is concerning, of course. This is something that we know has touched the lives of all of us in one form or another. Many of us know, in fact, more than one person who has sadly died from this virus. Now, here's what's interesting, a couple of things. You do see on the map here, we've seen a 20% increase in the number of cases in just the last 14 days. This was anticipated and forecasted because of spring break, the increase in variants, and you've likely heard what I've heard is we are in a race against time to vaccinate as many individuals as possible so that we protect those from the variants that are being developed and mutated and evolved. And we're going to talk a little bit about that in the next 20 minutes or so, but we are seeing the effects of this. We see once those cases go up, it's 2 to 3 weeks down the road where we see hospitalizations increase once again. Now, with the vaccines available, we will likely see less of a bump. I'm anticipating that it won't be anything like we saw in January and February, but we'll continue to watch. And then the last thing I want to draw your attention back to is the number of deaths, because this is quite interesting to me. When we look at the number of overall deaths in the US, that number is very similar to the total number of cases in South Carolina. So we were at 550,500 cases, or deaths rather, in the US. And in South Carolina, we've had 550,669 cases. So the deaths for US and the number of cases in South Carolina have been rather consistent and have been at pace with one another. So just an interesting fact, when you watch these trackers all the time, you start to pick up some of these nuances. And then the only other point I'll make here is we haven't quite seen the level of increase yet in South Carolina, but please believe that we are not far behind. And we saw this with the surge as well. And South Carolina on many days led the path when it came to states. In particular, the Upstate led the way. There was a time where Greenville County had the largest number of cases per size in the country. So let's move on. And we have all seen the testing sites available. Many of you have likely been tested for COVID, perhaps even more than once, as we've seen exposures or symptoms that may be confused with something else. You may have had COVID yourself. We do continue to encourage people to be tested if they're symptomatic or if they have been exposed to someone in a high-risk exposure situation, which means more than 15 minutes with someone who was diagnosed with COVID. This information will continue to change as we receive CDC guidelines. At this time, CDC is saying that for anyone who's been vaccinated, 2 weeks post-vaccination of your doses, if you're receiving a 2-dose series, For 90 days, so if you can follow me on that, for 90 days, you do not need to quarantine if you've been exposed. Therefore, you don't have to be tested either. However, keep in mind that 90-day window does indeed end, and until further guidance comes out, you're at that same quarantine and testing requirement as anyone else. So we're going to see this cycle. You see the numbers here, so I won't repeat them, except to share I am so grateful for our other healthcare partners and for DHEC and the numerous number of groups and organizations that have come together to test South Carolinians. If you recall, in the beginning, we had extremely limited supplies, and so we even had to be scarce with how we appropriated testing. Now we're encouraging people who've had asymptomatic exposures to get tested, people who are traveling. If you're having high-risk surgeries, we may ask before, we do test everyone who's also in the hospital as well. We've recently transitioned our testing in our organization to our primary care sites. If you have a PCP, then you can schedule that COVID test with your primary care provider. And otherwise, we are referring to the number of testing sites that are now available across the state of South Carolina. This is, again, part of getting back to normal. With the increase in vaccinations, we've actually seen a reduction in testing, and we'll see if that trend continues. Another trend we've seen, and that is digital health. And as this is something that's important to our organization, as it is, I'm sure, to many other healthcare organizations, we've been on this journey. However, COVID-19 and the current pandemic has accelerated these efforts. And we saw in the beginning where our online approach, or what we used to refer to as Smart Exam, that may be a term you're familiar with. It was an online questionnaire process, if you will, where you could dial in this app, and let's say you had a headache. You would be asked a number of questions, and within a half an hour, you would hear back from one of our nurse practitioners trained in our online module to get a response to you and treat your condition virtually. Well, that was our first step. And then fast forward into COVID, where clinics were limited with the number of patients they were seeing in person, particularly those who were symptomatic, and we turned on our virtual visits. That includes our video visits as well as telephone encounters. Now, we prefer the video. As a physician, I would share with you that I see a whole lot more in your eyes and your assessment of a personal exam that I can do through a video, and with the equipment now available to us with the TATT kit. You see that in the lower left-hand corner of the screen. This allows us to look into your ears. We can listen to your heart. We can listen to your lungs in the comfort of your home. So there are a number of remote monitoring tools that are now available that will continue to accelerate this path. And to provide some relativity for this convenience of access that is now available, in 2019, we would perform those online questionnaires, about 360 in a month. And then fast forward to this time in 2020, we do about 1,500 of those a month. But what I find is most exciting is the over 600,000 virtual care visits, be it video, real time, or synchronous, and telephone encounters that have occurred, and nearly 500,000 of those have been in the Upstate alone. In fact, some of you may have experienced your own virtual visit this past year. Now, hospitalizations have been a serious and concerning trend in our system for COVID. And we are pleased to say we have been on the downward trend, which is a very positive thing. We have taken care of 1/3 of all COVID patients that have required hospitalization in the state of South Carolina, whether it was through clinical trials and experimental therapy, or now it's been proven to be evidence-based treatment in our hospitals. And this has helped improve the care delivered across the state and what we've learned across the country. We have a South Carolina Clinical Grand Rounds session that is every Tuesday that's sponsored by DHEC, and 300 to 400 of your clinical experts across the state dial in together, sharing best practice and learning from one another. And it's been tremendously helpful to give the latest and most up-to-date treatment for COVID in our hospitalized space. And we've also treated individuals through outpatient therapy. Monoclonal antibody therapy is a type of a treatment that has been available for many diseases, be it cancer or autoimmune disease and various other reasons, including allergies. And we have seen bamlanivimab, which is a mouthful, bamlanivimab, and another monoclonal antibody now served up in a cocktail, if you will, just like Regeneron, which is also a monoclonal antibody cocktail, more than one together, to focus on outpatient therapy. This is for the highest risk patients that are at risk for hospitalization and death. So the data you see here is from DHEC. These are some numbers from a couple of weeks ago, but over 8,400 patients have been infused with this very important therapy across the state. And in the Prisma Health System, we are over 1,500 of those cases. And here's what we've learned. Those with the greatest risk for being hospitalized were more likely to have a hospitalization rate of 15%. Well, with this therapy, what we're seeing across the state of South Carolina is more of a 3.5% hospitalization rate. Our personal experience with these monoclonal antibody therapies has been closer to a 2.5 hospitalization rate. So for many reasons, that's been incredibly beneficial. But the part that's probably saved the most lives is allowing those beds that otherwise would have been taken up by these patients. We're able to keep them home for the individual patient, but being able to get to others as we had severe ICU shortages and medical surgical bed shortages across the state of South Carolina. We all work together collaboratively to find beds where these patients could be served. So again, this is one of those ways that contributed to the overall health of South Carolina by immediately recognizing the need for care even before those patients required hospitalization. So you may see your county listed here. Greenville County, of course, is about right in the middle. And these numbers continue to increase, but I wanted to share with you the most recent report that I had available. And the state coding there shows you where we've seen the greatest utilization of infusion therapy, and those numbers will continue to evolve. And now this is probably the most optimistic piece of the COVID pandemic, and that would be our vaccines that are now available. You're likely familiar with the fact that we now have 3 vaccines, Pfizer, Moderna, and Johnson & Johnson. At Prisma Health, we have received both the Pfizer vaccine and a limited amount of Johnson & Johnson for our communities. And this is absolutely critical to saving lives. Once we had access to the vaccine, the first impact we saw was with our team members. We had triple digits of team members that were out with COVID or because of exposure on any given day back in January. And we saw that number quickly dwindle into the double digits once we had access to the Pfizer vaccine. Now, the Johnson & Johnson vaccine that is much more portable is a 1-dose vaccine and will allow us to reach our communities in areas where we recognize there are barriers and perhaps not everyone is coming to the table. So we have used data available to us, for example, through the CDC and the vulnerability index for our mobile units to transport out our Johnson & Johnson vaccine, and in other cases, certainly our Pfizer vaccine, based on where we have the sickest patients, the lowest vaccination rates, and have focused on those areas for community engagement in improving our vaccination rates across the state. You see our vaccination sites listed here, and you may have heard us on the news or seen us on our website, and I'll show you that webpage in just a moment so you all will have access to it. You can certainly refer back to the website for any updates and news that will be available as this pandemic continues to evolve. You probably heard the news from last week, and hopefully if you have children who are 16 and above, you've encouraged them to step up and be vaccinated. What is exciting is we are seeing that appointments are available across the state. and across multiple vaccine providers. And we just encourage everyone who wants the vaccine to go and get it sooner rather than later. And I did briefly mention that Prisma Health itself, through our mobile units, has been following how we vaccinate or allocate vaccines based on communities. And our new regional process is going to do very similar things. And we had our first CARES panel meeting. This was set up by DHEC in 4 regions. We have advisory panels that are being stood up this week, and we'll continue to meet by region to determine where do we allocate the vaccine based on population, risk populations that are available, those with a higher rate of diabetes and hypertension, for example. Poverty rates will play into this information. And we heard very loud and clearly earlier today for the kickoff meeting that we'll be looking at the percentage of the population that is still unvaccinated. And this will become more important as we see these variants create more challenges, is that 2-week COVID-19 incident rate. So if you have a higher incidence rate, there's a good chance that you'll have more vaccine allocated to your region. So you see some examples there. I love the transparency we're getting from DHEC now in the top right-hand corner, where it lists Low Country through the Midlands, PD, and Upstate of the percentage of the population and what's actually been allocated. And you see the biggest difference is between Low Country and Upstate and the percent that's actually been allocated. So then remember the criteria that are also filtering into these decisions that we just spoke about a moment ago on the left-hand side of the screen. And so here are the numbers that we have available for the entire state of South Carolina. This information is from DHEC. As of just a couple of days ago, over 1.2 million South Carolinians have received at least one vaccine, and over 675,000 have completed their dose series, which is very exciting. However, we have a long way to go when you compare us to other states, considering we're not quite at a third receiving at least one vaccine. And we recognize that it's going to take about a 75% herd immunity to protect us all against COVID. So many weeks to come, but with increasing vaccine supply available in the future, this should help us increase that number and hopefully reach herd immunity in the state of South Carolina. Now, the last thing I'll draw your attention to as we're talking about vaccine supply is there was a recent mention as early as yesterday, I think it was, in the New York Times, that there was a quality control issue with the Janssen or the Johnson & Johnson vaccine, and there was a mixing between AstraZeneca, it's also a vector vaccine, with the Johnson & Johnson, and so 15 million vaccines had to be thrown out. My understanding is that hasn't affected the shipments of this week or next week, but then we will see a continued lull. This is a tremendous challenge for us, as everyone is hopeful that because this is the most practical vaccine with a one and done approach, but we will be ready once they're back on track to continue to increase that supply and the vaccination process going forward. Here's another slice of data for you. Again, we believe in transparency, and I think it's extremely important for our communities, in particular our leadership, with our leadership members in our communities, to look at the distribution of who's receiving the vaccine. We are still very concerned that there is a need to reach our Latino community as well as our Black community. What has been rather interesting for us is that we've seen that at our mass vaccination sites, it does not relate back to the percentages that we see within our communities. However, when we take our mobile units to neighborhoods and the zip codes where we see the greatest decrease, or rather than a decrease, a lower rate of vaccinations, we're able to right size that, and we see a significant increase in those who are represented by the neighborhoods that we attend. So we know that that process works. There are several events that are popping up with mobile units, including DHEC as well. And what we're hoping to do going forward is to better coordinate those events, because this is a limited supply most certainly. And if, for example, one community is going to 29681, then we want to make sure that the other mobile unit is perhaps going to 29605. So spreading these out and coordinating with all involved. This is why the collaboration and coordination between all vaccine providers and DHEC is critical as we go forward. And so this is oftentimes how we have felt with the vaccine arriving. In fact, this felt like day one for us. And our hope is that every single person that stands in line or stands up or raises their hand will certainly have access to that vaccine when they want that vaccine. And we continue to battle that challenge. Here's where we are so far in our organization. Over 300,000 vaccines have been administered through Prisma Health. We are the largest vaccinator in the state of South Carolina, and we wish we only had more vaccine. And we continue to use up what we have. Certainly you see our numbers here of what's been administered week by week, and that's according to the supply that we're actually given. Many have asked about severe allergic reactions or anaphylactic reactions. We have only reported 3, and those individuals required EpiPen utilization. And not surprising, they actually showed up to the vaccination site with their EpiPen in hand, as these were patients with a history of anaphylactic reactions. No patient required hospitalization, however, and we certainly have not had any deaths in our system. The information we've seen from the CDC is that there are 2 per 1 million. So per 1 million people receiving the vaccine, only 2 have suffered a severe allergic reaction. And those numbers tend to remain steady. Okay, now let's switch gears and talk just briefly about the variants that we're seeing now. The challenge we have here is something that is popping up across our country, and that is the variants. So this is the B117. You see South Carolina listed. These numbers will continue to increase. I was just reading earlier today that Houston is expecting their numbers to double in the next 7 days. And in fact, they're starting to see some health systems mandate vaccination of their employees because of this great risk coming forward. Michigan has seen a huge number of increase in cases, in fact, a doubling within just a few days, and Florida remains an area that is being closely watched, especially with spring break approaching, and the fear is that variants will then spread across the states because of vacation and traveling and people tending to relax their mask wearing, their social distancing, and hand washing. So we can't back down on that. We have to remain focused. And you see here the B1351 that's available. South Carolina is that color of green, continues to darken. We'll watch this very closely. We have also seen new variants pop up, in fact, in South Carolina. We'll continue to watch this. We are seeing what's referred to as vaccine breakthrough cases, people who've received the vaccine and then become positive and symptomatic with the virus. We are also starting to see very serious cases of patients who have now been hospitalized, who are vaccinated. So the reminder here is just because you've been vaccinated, it is not 100%. We still need to remain vigilant and encourage everyone to be vaccinated and continue our social distancing and masking, particularly when not everyone has had the opportunity to receive this important vaccine. And so here's some information on our mobile units. You heard me discuss some comments just a moment ago. We have received all 3 mobile units in Greenville County that were funded by the CARES Act. And we are tremendously grateful for the opportunity to serve our communities now. We have also received funding for 3 mobile units in the Midlands as well. And we are following this important criteria, as I mentioned, very similar to what DHEC is recommending for regional allocation. We do the same, utilizing our vulnerability index formula from the CDC. And specifically for our Johnson & Johnson vaccine community, we have focused on the homeless and the homebound, our group homes, and employers that are in exceptionally high vulnerability indices areas. So for example, I'll share with you, we took our Johnson & Johnson vaccine to Continental Tire in Sumter. And the reason for this was the 2 census tracts in Sumter show a vulnerability index of 92.4% to 99%. That means 99% worse than the rest of the state for access to healthcare. So for similar reasons, this is why we focused on our sheltered homeless as well as our homebound and others. That one and done approach has been extremely helpful for us. And as I mentioned, we also use our Pfizer vaccine. We are going out into our communities about twice a week, and you'll see us in the near future ramping up to 3 times a week. As we have more vaccine supply available, we have more opportunity to take it to more neighborhoods. And I'm getting very close to the end here. I just wanted to share this information with you to remind you that our prismahealth.org/vaccine page has a tremendous amount of information available, not only through Prisma Health, but also nationally recognized expert websites such as the CDC. You'll find updated information here, including frequently asked questions from the community, and our vaccine sites that are available and their hours of operation. And then that's it. That's everything I had to share with you in regard to the data, our experience at Prisma Health, and collaborations with others. Again, thank you so much for this opportunity. If there are any questions, I'd be more than happy to answer them. And I also want to be respectful of your time today.
Yes, well, thank you so much, Dr. Saccocio. Amazing amount of information. Certainly takes a while to digest it all, but we do have a few questions, and I'll start with a couple of those. The first one is related to the 90-day safe zone. Do you anticipate that as more data comes in, that could change to different? I think I saw something about the Pfizer that they're saying it may last 6 months or things of that nature. What does that look like, and is it different depending on which of the 3 vaccines you receive?
Mm-hmm. Excellent questions, and ones we will be paying very close attention to, as no doubt this information will change. As data becomes available to us, I am sure that the recommendations of the quarantine-free time will likely change. As I mentioned, it's currently set at 90 days, 2 weeks post your final dose, and this is for all vaccines, Pfizer, Moderna, and Johnson & Johnson at this time. But be prepared for the fall. What I'm anticipating is we will transition to a respiratory season, if you will, rather than what we've referred to in the past as the flu season. So you'll likely have an opportunity for your flu booster, your COVID booster, and there may even be other respiratory viruses in the future that we start to turn towards. But expect that we're not done. We will likely require boosters just based on the number of variants available and the immune response as we learn more about how long that actually lasts.
And that leads to the second question, which was asking specifically about a booster for the Pfizer vaccine. But the expectation, as I hear from you, is that all of them will need booster. And I guess it's too early to tell whether it will be like the flu shots now, where it's once a year, or it could be twice a year. I guess that again is information that will be fluid and could change over time.
Yes, that's correct. We'll see what that period of time looks like. I hope it's no more often than a year, but we shall see. Again, same for Pfizer, Moderna, and Johnson & Johnson at this time. As we go forward, what we've also seen with the flu vaccine is over time, the more flu boosters you've received, the less likely you are to have a terrible or severe response to the flu if exposed. I'd like to see the same for COVID. We still have so much to learn, so we'll have to wait and see what that looks like. But anticipate a booster. And, another question just came up today from someone, and I thought this might be interesting to you all. You do not have to receive the same booster as what you received for your original vaccine. And they've been very clear now, when you're receiving your series, your first doses, if you're getting the Pfizer first dose, you absolutely should receive Pfizer for your second dose. Now, if that's not possible, then getting a second dose of Moderna is fine. So that's where it starts to get confusing. But once you've gone through that initial series, boosters will be very different. So at least people won't have to focus on, well, what did I get the first time? Right. And next year, what do I need to get? We'll have more flexibility, is what we're anticipating.
So the next question asks about, does Prisma or DHEC track the volume of low-income residents who are receiving the vaccine? And before you answer that, I want to kind of add on to it, because as you're talking about boosters and long-term, I would think one of the biggest concerns is, you've talked about Prisma making a distinct effort to make sure to get to the most vulnerable and people in low-income areas and things. In 2 years or 3 years, if it's now clear that it's a cycle we have to do ongoing, I would think that's gonna really be an adjustment or something that DHEC and all of our health systems are gonna have to make sure that they are continuing to do, is reach into our lower income neighborhoods.
Certainly, I would assume so as well, that they'll be looking at parity and socioeconomic status. And in answer to your question, while we don't collect income information of patients when they receive the vaccine, we are able to make some inferences based on census tracts in certain zip codes. So that's where we overlay the data and indirectly can identify those that are in lower income neighborhoods and who we serve.
Great. And then a question specifically around the MyChart is, will you all, once a booster is needed, will you put in someone's MyChart? Is that the plan? That it's time for your booster or things like that? Is that kind of the next step?
I'm impressed, and I'm glad to hear that people are utilizing their patient portal, MyChart. And I see some folks smiling in healthcare on this call, because they know exactly where we're going with this. And yes, you can expect over time you'll be receiving outreach notice of when you're due for your next COVID booster.
Good. And Jim is getting well beyond my expertise with this next question when he says, is there an expectation in the medical or scientific community that the mRNA vaccines will be more long lasting?
Excellent question. And we don't know yet. It will be very interesting to see how the data plays out and the overall epidemiology for the various vaccines that are now available. What's great is not only does the US have access to the Pfizer and the Moderna and Johnson & Johnson, but other countries have begun vaccinating with AstraZeneca. We know Russia has their own vaccines they're utilizing. So hopefully we'll be able to gather this information and do a side-by-side comparison of efficacy rates and even reactions or temporary symptoms even that occur between the various vaccines.
Great. And the last question I want to ask is around the monoclonal antibody treatment. I assume that you didn't, I don't think, mention the expense or the cost to that. How, if you're a moderate or even middle income person, how is that, how are the health systems dealing with the cost of that and the potential for inequity as it relates to who gets it and who doesn't, related to incomes, or where does that stand?
Fortunately, the monoclonal antibody infusions, as they are not cheap, that's for certain, they're about $1,000 per infusion, have been provided by the government. Now, we recognize as we transition out of the COVID pandemic into COVID and the new normal, this will transition over to health insurance companies. However, at this time, anyone who is uninsured has their coverage for COVID through the government, and there's a way that we pass that through. But I am starting to see that payers, for example, I recently read an article, Blue Cross Blue Shield of North Carolina has decided that now they'll start passing through, in the form of co-insurance and co-payments, COVID therapy to the patient. We're starting to see all those private payers start to follow suit. So I'm anticipating over time that will be the case, just like any other virus, such as the flu when someone is hospitalized. That is a concern that we have when we look at funding and access to equitable care for everyone in South Carolina. We'll just have to continue to watch that. And at Prisma Health, we're still going to do our best to inspire health and serve with compassion for all those who have been exposed or infected with this deadly virus.
And before I let you go, real quick about international and also Canada. There's another lockdown in Europe, and Canada is still limiting travel. What are you hearing specifically there, and how does that relate to the U.S. and people wanting to travel and that over time?
I recently read that France is going on a 4-week lockdown. We're seeing similar things with other European countries, as you mentioned, Dean. In the U.S., we tend to be quite liberal with freedom of the individual versus health of the public. So we'll continue to watch. I'm not seeing any limitations thus far of Americans traveling to other places, but I have seen that we've limited others from countries outside of the US to travel into the US. So your guess is as good as mine there, and I'll keep watching the news. I hope you do the same. I certainly don't want to get stuck in a foreign country because of an exposure of COVID. So I'm going to remain vaccinated, and that's hopefully my passport to travel in the future.
Perfect. Well, Dr. Saccocio, thank you so much for your time and great information. And all of the material that you've provided will be in the summary that we send out to everyone. We are, of course, taping this TATT chat, so the video will be available as well. And we appreciate your offer. If anyone has any other questions, that we can reach out to you. So thanks again for being part of this and for all the great work that you and everyone in Prisma and all the health systems are doing.
My pleasure. Thank you so much. Take care and be safe.
Thank you. And with that, I am real quick going to give a couple updates. I don't think Erin is with us. Is she, Justine? I didn't see her come on. So
she's having some Wi-Fi issues, but I can do that part if you'd like. Or
okay, good. Well, let me real quick give a couple updates, and I'll turn it over to you, and you can introduce our other healthcare updates, as we mentioned, and also talk about what's going on with entrepreneurship. So real quick, I was asked, I think by Jeff earlier before we had the presentation about moving forward with events. And I am excited. We sent out, and hopefully you saw the notice. We are going to start with what we're calling TATT Reconnect. It's going to be a morning series every Friday beginning on April 16th, where we are going to have coffee, donuts, and conversation with up to 20 people in the large community room here in the complex that our office is in, Park 37. For those who have been there, is a lot of space. So we will be socially, smart with our distancing and masks and things. But we know it's time for people who want to get back to being able to be in person with each other. So we're going to do it kind of easing our way in there with these sessions beginning on April 16th. We are hosting most of them here with some of our board members leading. Some will be topical, and you can read all that information. We are going on May 14th down to Anderson to Tri-County Technical College, where they are going to host us. So we will have one in that part of the region, and we'll see how these go, and if we want to continue them through the summer and move them around a little bit. But again, limited to 20 people. We ask that you register in advance, and Erica has put the information in the website or in the chat for you to go to the website to do that. And with that, I am going to turn it over to Justine for a quick update on a couple entrepreneurship workshops, and then to our 2 county updates. Justine?
Thanks, Dean. I feel like I need to announce that I got my second vaccination today. Yay! at 10 a.m. and I'm feeling fine, but it's a lot more sore than that first one was, but it's going to be fine. I'm really excited. So Erin Oots wasn't able to make it. She had some Wi-Fi issues, but we wanted to share some of our Upstate entrepreneur ecosystem events that are coming up. We have, and I'll put a link to our page here in the chat. We have part 2 of our e-commerce series that is being presented by Piedmont SCORE on April 15th on Zoom, of course. The first one was done by Anna Para at the Women's Business Development Center, which was really interesting for those people who might be interested in developing an online store. And then we have Kunal Parikh, who is policy advisor to Senator Tim Scott, and he is going to do a legislative update on Wednesday, April 20th on Zoom, of course, and for small business owners and entrepreneurs. And he will also be talking about what to expect from this newish administration. So in the vein of health and talking about what's going on with vaccinations and COVID in the Upstate, we also have today Abby Russell with us. And she is with AnMed Health. And I'm sorry, we're doing Stefan first. We're doing Stefan first. Sorry, Abby. Because it's first on the paper. Stefan, I think I saw you on with AnMed from Anderson. He's going to give us a brief update of what's going on out there. Hey, thanks for joining us.
Hi, good afternoon. Thank you for having me. I trust you can hear me okay. I'm mobile at the moment. Okay, thank you. So glad to be here with you guys this afternoon. Tim had reached out to me yesterday and asked me to give you guys an update on kind of our vaccination efforts for Anderson County. I had actually left a meeting doing the same thing with a group of community-minded folks yesterday afternoon. So I've done this several times, but just to give you guys a sense of where we are in Anderson County and how we are assisting Anderson County with getting vaccinated. So back on December 17th, we gave our first vaccine at the medical center downtown in Anderson. And since then, we had given close to 35,000 doses of the Pfizer branded vaccine across our county, including obviously our employees, all those in phase 1, and including our EMS and first responders. Being able to do this, it would not have been possible without partnering with the Upstate groups, Anderson County Emergency Services, our Anderson County Civic Center, Tri-County Technical College, who has provided nursing students to assist in that endeavor. So from December 17th through January 16th, we provided most of those shots at the medical center or our North Campus on the Highway 81. On January 16th, we provided our first community vaccine mass vaccination clinic at the Anderson County Civic Center. We met with the folks at Anderson County Civic Center, and they offered to allow us to use that space, and we have occupied that space since January 16th. We run a clinic there in partnership with DHEC. So DHEC partners with us, and on Monday, Tuesday, and Wednesday of each week, DHEC has a clinic at the Civic Center, and on Thursday, Friday, and Saturday, we have a clinic in a separate space, but also occupying the Anderson Civic Center. During those clinics, we can provide over 1,200 vaccines each day to our community. Those are provided through appointment-based vaccine appointments. We have our MyChart scheduling system, but we also can make appointments through calling our hotline at 512-2897, 512-2897. I provide that to a lot of folks across the Upstate because we not only can assist you in getting an appointment, those folks have really become vaccine champions, so to speak, in terms of helping people to understand, what we're providing at the Civic Center, how to get there. We have had a number of groups from across the Upstate in our county to bring folks in buses, in church vans, in residential care facility vans. If we can get you there, we can get you through our process. Our team is outstanding. We have been able to celebrate our team's accomplishments across just over these last few months. Recently, 3 weeks ago, the governor was able to tour our facility and celebrate the team, but also to celebrate what we were able to do with our partnership with the districts, the school districts in Anderson County, by providing vaccines to our teachers and all the employees of those districts. So we were able to tour the governor through there along with teachers and get those folks vaccinated. The efforts continue today. I spent much of my morning over there this morning, and much like you, I saw many people very excited to get their second doses of vaccine. And what we were seeing today was 3 weeks ago, we were giving the first doses to our teachers here in Anderson County. So I saw a number of those folks coming back through today and excited about getting those second doses. So those are some of the things that we are encountering here at ANMed Health and in Anderson County. We continue to work with our community leaders, with Anderson County Emergency Services, to provide vaccines to some of those underserved areas. The meeting I was in yesterday was with DHEC and Anderson County Emergency Services, looking at pop-up clinics that DHEC can work with Anderson County Emergency Services, but also how we can provide support to those. We are asking DHEC, and as we heard from our Prisma representative, the Johnson & Johnson brand is scarce in South Carolina, but we have asked for that and put our order in for it to get our name on the list, so to speak, because obviously that is the way to get into some of our underserved and populations that obviously a 2-shot dose is problematic. So we had asked for that. We worked with DHEC to try and get on that list. And if we're able to do that, we can obviously further penetrate some of those areas with our emergency services folks, but along with the DHEC pop-up clinics. So that's kind of where we are. Obviously, I'm open to questions if there are any concerns or questions from the group, but that's where we stand right now in Anderson County and at ANMed Health.
Thank you so much. Even the people who are doing the injections are just so excited. Everyone's just so excited for our future. Okay, thanks very much. Let's do Spartanburg County. Abby Russell with Spartanburg Regional Health System is going to talk a bit about their response and what's going on out there. Thanks, Abby.
Yes, thank you. So as Justine mentioned, Spartanburg Regional Healthcare System is essentially taking care of Spartanburg County. We do service Union County and Cherokee County, and currently are making efforts to get out into those communities, a more concerted effort. Today, we have done just over 46,000 vaccines so far. Primarily, that is Spartanburg County. There is some tricklings of Cherokee County and Union County. We hold a community vaccine clinic that we opened on January 20th. That's when we first started our community vaccine clinic. At the time, we were doing around 500 vaccines a day out of that facility, Monday through Friday, essentially 9 to 4. We are up to almost 900 vaccines a day right now, with a combination of our vaccine clinic, community clinic out at USC Upstate, as well as we're starting to increase exposure into Union and Cherokee County through some of our medical practices. So they are doing somewhere in 30 to 50 a day, and we're increasing those numbers slowly through additional medical practices. Much like you've heard from the others, we're working with DHEC and many other areas. To be honest, we were really disappointed that we did not get the FEMA pod project in Upstate. That went to Richland. So that was a little bit of a hit and a disappointment for the Upstate that that is not coming to our area. So the hospital systems and all the other retailers that are trying to get the vaccine out are having to hopefully double up efforts to really get our community in the Upstate vaccinated. But it's been extremely positive. So that is, for us, 47,000 almost, both first and second doses. And you hear a lot about first and second and the success rate. One thing we do differently than some of the others is when you schedule your first vaccine with us, your second vaccine is scheduled at that same time. So we have been making sure that second vaccines are going to those individuals we vaccinated the first time. We've definitely been helping, trying to get some of those other areas that haven't been guaranteeing that second dose, trying to get those out, and working with DHEC to do so. They've kind of put out that ask that we start helping get those second doses out to community members who haven't been able to get it where they got their first, which is challenging, but certainly just trying to make sure we get everyone vaccinated. And I think, you know, on the actual COVID side, I think it's worth mentioning. We've seen a huge decline, which is very encouraging. But also, as Saria mentioned, we have a lot of concern with spring break right now and around the corner, and Easter coming up. We've seen a huge decline, but we're really worried with the people getting vaccinated and the increase of people gathering, that we will likely see another spike, and that's, sorry, dog ears, probably see another big spike, and that's concerning. But we are right around 50 inpatients at any 4 of our facilities, which is a huge decrease from January. Our max was 260 inpatient COVID cases. And testing has gone down tremendously. We're actually starting to decrease some of our testing sites. We do have testing sites in all 3 counties, and 4 sites in total. So that's been huge to decrease those testing sites, and we're trying to move some of that testing into more of our urgent care facilities, which are called immediate care centers in our area. But I think for us, just like you've heard from the others, is we encourage you to get out there, get vaccinated, but still practice social distancing, wear your mask. We have seen exactly what the others have shared. We're seeing some positive cases come through after being vaccinated, which is certainly frustrating, but it's, you know, we've got to practice that safe social distancing and mask wearing, and just continue towards that herd immunity. So I think that covers everything you'd asked. So any questions?
Thank you so much. I think if Mayor Roberts were here, that's exactly what he would say at the end. Right, Dean?
You broke up, so I missed it, but I am going to trust you that you were right, Justine. Well, let me close by again saying, you know, thank you to everybody. It is amazing, you know, what's going on. I will give you kind of my personal update. I went on the TATT webpage today for COVID that we created a little over a year ago, with all the links, saying, okay, if I can go, you know, is this helpful to use this to be able to go and find to schedule a shot? So I went on our page, and Erica is going to put the link up there for those who don't have it, and very quickly was able to find the link to the site where I could find a vaccine, and very easily scheduled a vaccine for Monday. And like Abby said, it also then scheduled me for my second one. So you know, I would encourage you, if you have not already, whether it's our site or some other place, to find ways to get the vaccine, you know, scheduled if you haven't already, and go ahead and do it. It's very easy, and I'm hopeful that we will all be able to be in person for some of our events by later in the year. And you know, this has been very encouraging for me today to hear all the great positives. You know, it was a long road to get to where we are now, where I think things are turning, where everybody is getting with the vaccines and things. And so that's very positive. For our next TATT chat on April 15th, we will hear from another industry that has had a tough time, but is starting to come back, and that is GSP Airport. Scott Carr, our good friend from there, will be with us on April 15th. So Erica has put that registration link in the chat, and we hope you will plan on joining us on April 15th. So I look outside, and it's a beautiful sunny day, and I am hopeful that will continue over the weekend. So I hope you get to enjoy a beautiful weekend, and look forward to seeing you back on TATT Chat again on April 15th. So we are adjourned, and thank you everybody again, and have a great day.
Thank you.